Hello, and welcome to Boomer Health at Home. I'm your host, Maggie Jess, Director of Nursing at Ameristaff Nursing Services. On today's show, I have the pleasure of talking with ER physician Dr. Sarah Ornesian. We are going to talk about everything that encompasses an ER visit and what to expect if you're headed to the ER this season. Hi, Dr. Ornesian. How are you today?
Good morning. Good, thank you.
Great. Thank you so much for coming back on the show with us.
Thank you for having me.
So the last time you were on our show, you were kind of bi-coastal. You were here in Michigan practicing and on the East Coast. Are you currently still bi-coastal?
I am not. I have permanently moved back to Michigan.
Oh, we're so happy to have you back.
Thank you.
So you are currently in a hospital within the southeastern Michigan area. So if you don't mind telling our viewers, what are you seeing in the ERs coming in, like let's say the past couple months and like current as of yesterday?
So we are seeing a lot of the normal things we see in the ER, which are big basic complaints of chest pain and abdominal pain. Those are kind of the bread and butter of the patients we see in the ER. But mainly the past couple of months and recently, we have seen a spike in our common colds, viruses, specifically to the flu. A lot of people with fevers, chills, cough, congestion that are coming in that are quite severe.
Okay. How many would you say out of the people that you see come in get admitted to the hospital?
So that I see, it's roughly anywhere from 20 to 25% of the patients that I see will be admitted to the hospital.
Okay. So that's a good chunk that you're not admitting. Would you call that misuse of the ER, or is that just they're not appropriate for an admission to the hospital?
I would think it would be half and half. So I don't really want to say misuse because everyone is sick and they need care. Whether it's appropriate to come to the ER is hard to say. It's always easier to say that after the fact when you've done an entire workup and then everything looks okay and they can follow up, whether it be with a specialist or with their primary care doctor. But for the most part, people most likely will need to come to the ER so we can figure out what's happening.
Okay. So you see that less and less, kind of like you said, you don't want to say misuse, because I know that was a big factor. Years ago, we would hear that, like, don't use the ER. We have urgent cares. Call your physician first. We're not your first stop. Don't use us as your primary care physician.
Correct. But within the past couple of years, especially with the pandemic, when primary care offices weren't open and now they are opening up, but they're not able to get to see their physician as quickly as they used to be. So it is convenient to go to an urgent care or to go to an ER.
In your opinion, do you think that the pandemic drove some of our population to start becoming more preventative?
That's hard to say. Yes and no. I think that I think that a lot of people were just scared. And I think that now people are becoming more comfortable going out in public. Whether they're being kind of proactive with their health is hard to say, but I do believe people are just becoming more aware of how infections are spread and to wash their hands.
That's great. Yeah, washing your hands is huge. We learned that, if nothing else, right?
Yes, correct.
So we've been hearing a lot about, it's cold and flu season, it's RSV season. I was speaking with one of my patients the other day, and, a friend of a friend had a 6-hour wait time at the ER. What what would you tell to a patient or a family member that's frustrated by a long wait time in the ER?
Well, unfortunately, that's how things are going right now. The hospital is full. When the hospital is full, we are full in the ER. We are holding patients to be admitted to the ER or to the hospital, I mean. And so it's very hard. We're trying to do our best, as I think every hospital in the US is doing their best, as we're working out of the waiting room. So we've tried to adapt to work out of the waiting room to take care of patients so they don't have those long wait times. But if they do, a lot of us are going out to the waiting room, us as an ER physicians, and apologizing and trying to get people back. And unfortunately, sometimes the sicker you are, the quicker you get back. So when you come in and if your vital signs are stable and you've had abdominal pain, let's say for a couple of months, you may not be back with someone who's having crushing chest pain whose vitals are not stable.
Right. And I think we can all respect that, or should, or be able to, correct? So you had mentioned you're seeing a lot of abdominal pain and chest pain, and then a lot of like the cold and flu symptoms. Does the ER provide the flu vaccine?
Most ERs don't provide the flu vaccine. That is something that you can get at either your primary care doctor. Urgent cares may, so I would call ahead, but also Walgreens, CVS, Rite Aid, they have been providing vaccines as well, and they are very easy to schedule. Or you
Okay,
can call your local health department.
wonderful. I know also we provide flu vaccines in the home for all of our patients. And then at our freestanding location in Troy, we also have flu vaccines available for those people that would like it. So I guess in regards to doing things in the home and elderly patients here at Ameristaff, we have a lot of patients that come to us from the hospital that require nursing care in the home, physical therapy, occupational therapy, all things that we can do. If you see a patient and you see that need there for them, is that something you as a ER provider can prescribe, or do they have to be admitted to the hospital first? How does that work?
They actually have to be admitted to the hospital first because a lot goes into play with that we can't really do in the ER. So you need a case manager, you need more support staff than we have in the ER to set that up. So they do have to actually be admitted. So because of insurance reasons and things like that, a lot goes into play with getting the appropriate place, the appropriate care, and to make sure that insurance companies are going to pay for their care.
Okay. So there seems to be kind of like a certain criteria and a certain algorithm that needs to be followed once you're admitted to the hospital.
Correct.
Okay, great. That's wonderful information to have for our viewers because I know I get that question a lot. Well, I was in the ER and I think I need physical therapy. Well, if you weren't admitted, maybe go see your primary care provider. That would be some good advice.
Correct. Yes.
Okay, great. So, my final question for you would be in this peak cold and flu season, excuse me, what in your opinion is the best way to help prevent the spread of illness throughout the winter months?
A couple of things you can do. Number one is wash your hands. Number two is if you're not feeling well, please stay away, stay home. And if you're still not feeling well and circumstances where you do live with a lot of people in your home, again, washing hands, wearing a mask, kind of staying in certain areas of the home if possible would be best because we really don't want to keep spreading illnesses, viruses, infections to other people if we don't have to.
Okay. It sounds like mask wearing is kind of like a way of helping prevent spread.
Correct.
And it's continued. I mean, I know we've been going through COVID and all of that, but this isn't going away.
Correct. It's not going away. So, and I think COVID did help keep the flu virus at bay. At some points, people were social distancing, people were wearing masks. And I think that now we're not social distancing, we're not wearing masks, but we need to keep up with hand washing. And if you don't feel well, to stay home.
Okay, great. Well, Dr. Ornesian, thank you so much for your time and all of your great insight.
Thank you so much.
This concludes our show at Boomer Health at Home. I'm your host, Maggie Jess, Director of Nursing at Ameristaff Nursing Services. Thank you so much for joining us. Stay safe and healthy.
Hi, my name is Greg Jamian, and you've been watching Boomer Health at Home, powered by over 40 years of home health care experience and knowledge, along with our program sponsor, AmeriCare Medical. And please, don't forget to like us if you enjoyed our show.